My name is Mitchell Levy. I'm a professor of medicine at the Alpert Medical School at Brown University and chief of the Division of Pulmonary, Critical Care, and Sleep Medicine, and the medical director of the medical ICU at Rhode Island Hospital. I think there are a couple of reasons to be interested in our division, and two really come to mind. First, we've recruited over the last 2 or 3 years some exciting young faculty who are doing great research. Dr. Corey Ventotullo came from Columbia University and is becoming renowned for her work in pulmonary hypertension and gender differences in pulmonary hypertension. Dr. Jason Aliota, who is a homegrown talent, is working in stem cell research and microparticles, also in pulmonary hypertension and other pulmonary diseases. And Dr. Barry Shea, who we recently recruited from Harvard and Mass General Hospital, is now the head of the interstitial lung disease program here at Rhode Island Hospital. And I'm very proud of the fact that we have young faculty who are just building their careers. And in many ways, it reflects the tenor of the division. I think that we have faculty who are hungry, are good teachers, are just learning themselves, and are developing national and international reputations in their respective fields. There's another point that I think is also a good reason to be interested either as a prospective fellow or a faculty member who's interested in making a change, and that is the morale in the division. I've worked in other divisions and other universities, so I know how intense the atmosphere can be. Often amongst young investigators, there's a lot of competition for grants, competition for patients, and they don't always get along all that well. And the relationship between faculty and interns, residents, and fellows is not always great. But that's not true here at Brown. In fact, we have quite the opposite. The relationship amongst the faculty is extremely collaborative and collegial. We have a new dean, Jack Elias, who also happens to be a very well-known pulmonary critical care physician, and he's already started a series of Dean's Awards that's fostered even more collaboration amongst the faculty, both within the division and across the university. And finally, the relationship between the faculty and the fellows and within the fellows is remarkably collaborative and friendly. We have Journal Club once a month in my house that we've had for almost 20 years, and the fellows really get along very, very well with each other and with the faculty, and I think that's one of the strongest points about our division. The division is growing. Not only have we recruited new young faculty, but I've been chief now for about 4 or 5 years, and as part of the package that I received in becoming chief, I still have 2 more faculty, academic pulmonary faculty to recruit, and 1 faculty in health services research and critical care. So I'm already excited about the quality and youth of the faculty, and it's only going to get stronger. And I think that's that environment of collaboration and collegiality and hunger for growing a career is going to become even more evident over the next several years. This is a perfect time to become part of this division.